We're now ready to start week 4 of our 6-week webinar. So I hope you're all keeping well and safe. The meeting would again like to extend a warm welcome to you all. And actually to those of you who have been here with us for the last 3 weeks, thank you. And for those who are newcomers tonight, you're very welcome. So these workshops are very much focusing on cancer patients and their families who have been through a cancer diagnosis and treatment, and for those also who are on ongoing treatment, so for people with metastatic cancers. So I suppose really we're trying to keep us all connected, and that's why we have our webinar series here. And it has been a great asset in these times of isolation. So thank you all for tuning in. And just to start off, infectious disease pandemics like coronavirus can be worrying. This can affect your mental health, but there are many things you can do to mind yourself and look after your mental health during this time. So many people's lives will change and are changing, but in time this will pass. You may notice some of the following: increased anxiety, feeling stressed, finding yourself excessively checking for symptoms in yourself and in others, becoming irritable more easily, feeling insecure or unsettled, fearing that normal aches and pains might be the virus, having trouble sleeping, and we had a whole conversation about that last week, feeling helpless or a lack of control, and having irrational thoughts. Does a lot of this sound similar to you and familiar? For those of you in the audience who have survived cancer and all its treatment, and for those of you on ongoing treatment, the feelings and emotions experienced here are similar. It all comes back, or maybe it never goes away. The isolation, the uncertainty, the fear, and the anger as simply not being able to get on with your life. We're going to have an interactive conversation with Dr. Eddie Murphy, who's here with us now, thankfully, and I'll introduce him shortly. And he'll teach us and have a conversation about how to mind our mental health during this time with cancer and COVID. So please do use these learning experiences as an opportunity week on week to make an action plan for yourself and work on achieving it over the 6-week period of time and beyond for the rest, in life. So for the first 2 weeks, we learned about diet and exercise, looking about how much fruit we eat. Sorry, it's not moving on. So how much fruit we might eat in a day, and thinking about whether we would need to change our behaviours in that way. We also listened to Dr. Laurie McDermott talk last week about being active, being physically active, the importance of not sitting as much anymore, and getting up every 20 minutes because the sitting is the new smoking. And that's quite a stark conversation to be having and a realization. And last week we learned about sleeping well, and this week we're going to learn more about managing our thoughts, feelings, and managing stress. So do sit back and take away what you want, what you can, and what is important for you tonight. I'm Helen Forrest, the Director of Nursing Services at the Marie Keating Foundation. So I'm going to go through a couple of housekeeping rules before we start. And if you've been with us for the last 3 weeks, you probably know this very well by now. But for those of you who are new to us, please make yourselves comfortable. You're in your own homes, so make sure you can hear us and see us and have a drink to hand. And as I said earlier, make sure you move every 20 minutes. If you have a phone beside you, it's a good idea to turn it off or silence it. As an attendee, you do not have the ability to speak to us, nor can you turn on your video. There is a question and answer button, and this is really important for this session because it's an interactive session. We would be very obliged if you would use it. This is being moderated by our senior oncology nurse, Bernie Carter. So thank you, Bernie, for helping and always there for us. So we'd love you to participate during the webinar by asking questions, and you can do this either anonymously or by name, whichever you would prefer. You will find the Q&A button at the bottom of your screen. So click into this, type your question and hit the return key, return or enter key. You must do this in order for us to receive that question. Keep an eye on the questions as they're being submitted. You might want to ask a similar question, and if you see a like icon, like the icon on Facebook, you can actually press that and those questions will go to the top of the queue. We're also going to surprise you tonight with a poll, and we haven't done that in the last 3 weeks, so that will be interesting, and that should hopefully help us to open up a channel of communication. There is a chat button there that would often be used for a kind of a chat, but we're not going to use that tonight because we do have our expert in the background moderating our questions. The webinars are being recorded, so if you would like to go back onto our website into information on COVID for cancer, you will find all our recorded webinars for the last 3 weeks, and this one will be available very shortly. So it's also nice to know, I suppose, who we're networking with and who's in the audience. We don't get to see people, so it's nice to know that, you know, there are people there, and we do have over 60 people registered tonight, which is fantastic. We'd like to thank our committed sponsors to our webinar series and a lot of other campaigns we run, Roche. We would also like to welcome and thank our Marie Keating staff, our nurses and staff, and Liz Yates, our CEO. Those who have attended our Survive and Thrive programs in the past, face-to-face, will have, you know, some idea of how this runs prior to COVID. And members of our Positive Living group are women with metastatic breast cancer, and for all the men and women in this wider community. And to you, as I mentioned earlier, those of you who've been affected by cancer and understand what it is like for you and your family to live through this, and especially now. So you will have received an agenda, and we've been through week 1 with Aoibhinn Bannon, a registered dietitian. Week 2 was Dr. Laurie McDermott, as I mentioned, keeping physically active at home. And last week we heard from Breach Leddy, a sleep psychologist. Next week, we're looking forward to hearing from Professor Michaela Higgins, who's going to look at managing stress and anxiety in the hospital setting, particularly because it's something we're hearing a lot from patients who are either going in maybe for follow-up treatment or scans, or maybe on regular treatment. So there's a worry and an anxiety attached to attending hospitals. And we want to hear it from somebody who's looking after people there. And then on week 6, we're going to look at managing side effects of treatment, and that's with Mary Moriarty from St. Vincent's Hospital. So with us this evening is our special guest, and Eddie and I go back a long way. We trained as nurses back in the 80s, and we have some very fond memories. So Eddie is a clinical psychologist and adjunct associate professor from UCD. He's a well-known TV psychologist, where his trusted style, practical, respectful, and hope-orientated approach has a strong solution focus. His passion and enthusiasm about well-being is anchored in evidence-based psychology. He is an author and the bestseller of Becoming Your Real Self, a practical toolkit to manage everyday problems. So Eddie, I'm going to stop sharing my screen now, and we'll both appear on screen. You're very welcome. We're delighted to have you here. And I'm sure you've drawn a lot of people, you know, to our attention to talk about managing your self-health or looking after your mental health during this time. So thank you, Eddie.
Good. It's good to speak to you. So I'm going to, first of all, can you? I'm on 2 different Zoom processes here at the moment. So I'm going to turn off this one, and please God, I'm going to stay on the one that has the best connection. So can you see me and hear me okay?
Yes. Great.
So first of all, thank you very much to Mary Keating for asking me tonight. Really appreciate the opportunity to talk to you, and for any questions that people have coming in tonight, I'll do my best to support and answer them. I think we've lots of interesting questions already coming through. Yeah, we go back a long way back time. In 1980s, myself and Helen trained in Romford in Essex, and My nursing career lasted about 10 to 12 years. I'm grateful for that nursing career, because it's given me a different insight than many psychologists, because of when you work on a hands-on, touch-based profession in caring, and then you move to psychology where you just step back and there's different types of boundaries, but it's very, very interesting.
Excellent. So Eddie, what is it like out there for you at the moment? What kind of experience, what people are coming to see you and what kind of questions they have for you?
So I suppose from a personal point of view, my wife Carol had cancer about 2.5 years ago. And the summer of 2018 was sort of a wipeout from our family point of view. Carol had treatment. So we're in a cocooning phase, and we've just more recently talked about that Carol decided to let me talk about it a little bit more, and I respected her privacy on that. But this situation, we came to a point that we were talking about it. Can you hear me okay still?
Yes.
Yeah. That we were talking about it in a more open way to try and, because I think this is a point where a lot of people are in the same boat, and having similar experiences is an opportunity to share and connect. So we've been cocooning. I've been going out in and out a little bit, and as the restrictions have reduced, we're getting out there. My main work is in the health HSE, and I'm head of psychology in Laois Shoffley. And we're, apart from providing services to lots of people, we're also planning services in response to this COVID period as well.
Okay. Let me just see if there's any. Oh yes, so I've got some questions here, Eddie. I suppose there are a number of people in the audience, as you know, who are either have had cancer and are often known as cancer survivors, and there are a number of people in the audience also who may be carers, and people who are on regular treatment. So the first question here is from Liz. And it says, "Hi Eddie, I have had cancer twice, and whilst I am out the other side for over 6 years now, I still worry about it coming back. What is your advice to help me cope with this anxiety?"
I'd start with saying that to normalize the worry, that it's very normal once a person has cancer to be really concerned about it coming back. It's total understandable worry. The question is then, how much does that worry impact on your life? Does it impact on you in such a way that it's restricting your life? That the normal worry is becoming what we going into the clinical range of worry and anxiety? And if so, then maybe connecting back with I think there's a number of different things. It's trying to understand it in a way that is it normal or is it beyond normal? If it's beyond normal, then it's causing distress. If it's causing distress, then it's getting support and intervention is a way to go. More recently, and there's patchy services in terms of psycho-oncology, psychology, oncology, obviously, oncology, cancer care, and nationally there's some really excellent services, and then there's some areas nationally, wrongly in my view, that there's a gap in service provision for around psycho-oncology. So identifying whether it's in that distressing and abnormal phase, and then to do something about it, starting to do something about it, to sort of managing it, to acknowledge it, but to manage it. See, it's interesting because some anxieties are prevalent, and a lot of people will come through with different levels of anxieties and stress. I suppose one of the things about cancer is that it's when people would say with anxiety in the absence of cancer, you can sort of say, well, we can manage that cancer, or we can manage that anxiety in the absence of cancer, because there's quite often what they're fearful of is not present. Mm-hmm. But there is a presence of a cancer, so that makes it more challenging. So I'm just getting feedback. That's why I'm sort of taking ahead.
So I hope that probably maybe will help Liz, you know, to actually help manage and acknowledge her anxiety in the first place. Really important.
But when are people getting feedback? Just is it getting distortion, or is it coming through okay?
I think it's going through okay. I mean, maybe one of my team will let me know if it isn't, but I think it is going through okay. I'm not hearing anything, Eddie, from my side. Okay, you ready for another question there, Eddie?
I am.
I think we've lost Eddie there for a minute, so hope that maybe we'll wait for him to try and come back in. Okay, you're back. He did this to me when I was nursing too. He used to disappear. Can we hear you, Eddie?
Hear you fine, yeah.
Yeah, okay, we're back. Okay, Eddie, you ready for the second question here? Okay, so a question from Linda. Hi, Eddie. I am looking after my father-in-law who has bladder cancer. How do I manage his need to want to stay dependent or I'd say independent, and maintain his dignity while still being there for him? Both he and I are feeling quite anxious.
Yeah, so I think it starts with a conversation really around. So Linda, thanks very much for the question. It's always challenging. So you're looking after. People want to remain independent, okay? So I think there's a negotiation going on. You don't want to create you don't want to overcare. Sometimes I call it overcaring, because when you end up overcaring, and you probably found this, people that have experienced cancer, that people end up overcaring for you, and you get totally frustrated because you want to assert your independence and you want to maintain that level of independence. Just trying to hit that balance on care needs, and sometimes, and it's really challenging actually, because your care needs will change over time, because you're trying to, as your dependency might go up during periods, then that care need will need to go up. But then as you get more independent and stronger again, maybe as you go through treatment cycles and stuff like that. So it's hitting a balance, and the only way to do that, I think, is around communication. Actually, having to communicate. Like, I often think it's actually just outside of cancer. I just think it's like how we communicate about our dependency and our care needs in life is like, I think it's something like the commitment is I'll maintain your independence as long as possible. But sometimes there's a balance too, because by maintaining someone's independence, you might be at your own level of, some people are a level of independence, but they're actually quite at risk as well. So it's hitting that balance is tricky. This is a tricky area. And, tonight I would say it's acknowledging the space that is a tricky space, a tricky world, as opposed to simple solutions to simple problems. In fact, actually, one of the things I'm interested in, and we're going to talk about, is the whole area of stress and anxiety. And we have a little poll here for people, maybe to get a feel for who's listening in and looking in tonight, where your levels of anxiety are. So we're going to stick up a poll now, and we're going to ask you just over the next 10 seconds. Don't think about it too much. Just answer the first word that comes to your, so it's in terms of your levels of stress.
So please rate your stress. 1 equals very low, 2 equals low, 3 is moderate, 4 is high, and 5 is very high. So I've just launched that out there now, and we'll see what we come back with, Eddie.
Okay, that'd be great, yeah. So you just press a button and then you submit, yeah?
Yeah.
And we get an answer.
They're all coming in.
Yeah, so
interesting.
Interesting to look at.
Sorry, I was going to say that question was interesting, Eddie, in terms of being a carer, isn't it? Because sometimes we forget about the carers in our lives as well, in particular, around cancer. So it's important to acknowledge and recognize them too, isn't it?
Well, that's what my role, I suppose, is that I'm a carer and a husband, and I suppose you have many different roles. We have all different roles, and I suppose roles are really interesting actually, because when we look at roles and sometimes we look at, in psychology, we often look at a thing called the sick role, where people embrace, in a peculiar way, a level of sick role, where you're trying to extract somebody out from their sick role as to the person they were before they got sick. As if, you know, that you're bigger. I would say, like, to whoever's listening, watching tonight, that, you know, labels are for tins of beans, you know. Labels are for cans. Labels aren't for people. You're bigger than any label that can be put on you. So yeah, you're broader than any label. You're deeper than any label. You're more worthy than any label. It might be something that along the way you've picked up a label, but you don't have to. You don't have to live all parts of that label. Yeah.
Okay. Okay, so thanks for that, Eddie. So we're looking at the poll now, and we have some answers here. So we've got an 87% response, which is fantastic. So 7% of people have actually rated their stress as low. That's number 2. 61% have rated it as moderate, and 32% have rated it high.
That doesn't add up to 100% now. I'm trying to figure out how that way.
It's not 20. Yeah, so 62, 31, and 7. And
what is it again?
So 62, 31, and 7.
And 62 is?
60 and 30 is 90, and then you have 7, 2, and 1 is 100%.
Yeah. So what's the percentage? I can't see the poll in front of me.
Oh, yeah.
What's the percentage from 3 upwards, from moderate upwards? What's the?
From 3, well, 2 is equals low, which is 7%. And then from 3 upwards, moderate to high, there's no very high actually. So moderate to high is 93%.
Yeah, okay. So that would, now that explains a lot to me. So between moderate to high, there's a significant, like 93%. So if 100 people are watching here now, 93% are experiencing moderate to high levels of anxiety. And maybe what I'd like people to do in terms of stress, not stress, anxiety. So maybe if I could just ask people in the chat that if they could type the emotions that they're feeling. What emotions? Now, emotions are interesting. Emotions can be described in one word, like as in withdrawn, bored, anxious, worried, stressed, sad, zest, happy, impulsive. So what are the dominant emotions going on for people over the last week? That'd be very interesting to look at that.
Okay, so we said earlier we don't use the chat button, but maybe we will for this if people want to put maybe.
I do apologise. I break
not
rules
at all.
all.
No, that's fine. I'm just kind of saying it out loud so that people do use the chat button. So if you want to put express an emotion within the chat, that'd be great.
So what I find is I have a weekly Facebook at 9:30 on a Thursday night at 9:30, and we do a lot of this sort of interactivity whereby I'm seeing them now: anxious, frustrated, scared, Jennifer, and it's different words are coming through, and it's giving a sense of when we start naming things, then we start being able to identify our feelings, and our feelings can be triggered by certain things: uncertainty, scared, and frustrated. And then different thoughts. What's really interesting is I'm fearful. I'm careful whether I hear happy or sad. So quite emotional experiences there. Just gonna have a look a few down coming through. What it is that is driving each thought: no control, scared and sad, anxious that I would get the virus. Okay, so there's real world stress and anxiety. It gives you a good feel for it, really, where people are at. The unknown is scary, and that's the thing about anxiety and stress. And see, there's an uncertainty. The pandemic and the coronavirus has created an uncertainty, and we look for certainty in our world. One of the things we can be doing is we can engage in scanning. where we're scanning, putting on lenses, and we're scanning the news, scanning the environment, scanning our social media, scanning, and continuous scanning will only feed into your anxiety. So I would encourage you to reduce, like dip in once to the news if that's something you need to do. Because believe me, when it comes to coronavirus, and if something happens, you will be informed. I guarantee you, you will be informed. You don't have to be continually scanning for getting information. There's a lot of interesting emotions there around feeling trapped, feeling extremely anxious and scared, no control, scared and frustrated, stuck and concerned, and fed up. And you can see that in a community such as we're connecting now in community, that many people are experiencing the same thing, and the absence of certainty and the absence of control. And one of the ways to think about this is to think about 3 circles. In our lives, we've our circle of control, our circle of influence, and our circle of concern. And in a non-cancer situation, we'd often think our circle of control is reasonably big, okay? But cancer's thrown that all up in the air. Cancer's robbed us of our circle of control in one way, because there's an uncertainty. It just brings uncertainty. And it fundamentally throws us in such a way. And it throws families, it throws carers. And, so the things we can control, though, are really important things around our hand washing, our social distancing, our face covering in public situations. These are things that we can control and will have significant impact because, for example, we like many people watching, I'm going to call them viewer, participants. Many participants, they probably had their clinic schedule. Like our Karen now has had voicemail, phone-based clinic, but now we're moving to July that Carol will be going up for a review checkup, a review scan, and the scans have been put off up to this one. So we'll be ensuring that the face covering, the masks, and it's balancing too that living a life out, living with the fear of this virus, but not being overwhelmed by it as well. It's really important. Like once you're face covering, once you're washing your hands, keep your social distancing, you're then in your circle of control. Once you step out of that into your circle of concern, that's where your anxiety really increases.
I have a question here, Eddie, actually in relation to that, which is kind of nice to follow on from now. It's somebody who's asked anonymously. Hi, Eddie. Yeah. I find that with isolating and cocooning that I am more dependent on WhatsApp and Facebook. I am worried that I will be unable to reduce my use after this COVID. Will we lose our ability to be able to talk face-to-face to people? I am also very anxious when I have to go outside. Do you have any advice on how to deal with this?
So I think, first of all, in my circle of control, my hand washing, social distancing, and face mask, and that you have that rigid structure routine in terms of when you go outside, so that okay, I'm staying in control of this piece. I wouldn't get too caught up about that dependency on WhatsApp and Facebook, because if that's what you're doing to connect, there's a huge amount of in all the work I'm doing now, what really we're seeing is a level of isolation and loneliness for some individuals, or many individuals really. And I'm sure people watching your participants are parents, and they're so many different hats on. They're not, it's not just cancer hat. They're parents, they're workers, or maybe they're in recovery. They're sons or daughters, or daughters to mums, and so lots of different things going on. You've more. So I think I wouldn't get too caught up in the WhatsApp and the Facebook, because I believe that you just will naturally rebalance out after these restrictions are lifted for us. Yeah.
Yeah, and I suppose like there's a reality in that as well, because we're all Zooming at the moment, and although it can be hard, you know, face to face, like to be in a person's face, it's very convenient, isn't it, as well, in terms of travel? And you often wonder, do we come out of this as easily as we got ourselves into it?
And I think there's going to be lots of new things, new ways of working, new ways of linking, and etc. And it could be that people that might have four appointments a year might only actually travel for 2 face-to-face appointments or something like that. You know, it may or may not. Or people will start requesting different type of appointments instead of doing that travel now. Is it okay if we do that by Zoom or something like that, or by phone?
Yeah.
And that can create more efficiencies as well, you know.
Yeah. Okay, so let me see what other questions we have here. Hi Eddie, what do you think of, Kieran is asking this. Hi Eddie, what do you think of mindfulness as a coping technique?
Yes, so there's a strong evidence for mindfulness in this whole area of anxiety. Really strong evidence, and actually one of the best. So there's different types of mindfulness. There's mindfulness fundamentally is, if you think about it, worry is about the future, and regret, sadness, depression is something about the past. It's like a regret about the past. And mindfulness is about being in the present, in this space. And so in this space, I'm not worried about the future, or not regretting about something I did or didn't do in the past. And how do we get to that present? It can be, you asked people, you've invited people to drink water tonight, okay? So a mindful moment would be that you take your water, you feel that, so if you just bear with me, if anyone has a glass of water or a drink with them, if you pick it up in your hand, if you can feel the temperature of that. So if you just focus on my voice for a moment, if you can feel the temperature on that, the glass or the cup, or if you put your hand around it, feel it. And if you can bring it to your mouth without actually drinking your water, and if you just take it in, and then you just get to the water that it actually touches your lip, and what is that sensation like? And then you bring the water into your mouth, and you just hold it there, and you just notice the temperature, and then notice that the muscles that are working, and then just let it down and swallow, and be thankful for that swallow. And that's just that moment where you're just focusing on the simple taste of water, water coming into your body and nourishing you and providing you hydration. And mindfulness can be done in simple moments, such as washing your hands, such as standing out in your garden with your socks off, standing on the grass, and listening to the birds, or listening to many different sounds, and tuning yourself. So there's mindful, we can do mindful thoughts to ourselves, mindful loving kindness. And there's a really good, one of the evidence-based training for mindfulness is a thing called MBSR, Mindfulness-Based Stress Reduction. It's an 8-week program. You've had Paul Dalton on with Mary Keating, excellent psychologist who does a lot of mindfulness. And MBSR, the mindfulness-based stress reduction, is an 8-week program where people can learn mindfulness, and it really is a powerful tool that can be used. So mindfulness is not just about thinking positive, or mindfulness is about being in the present. And to be good at mindfulness, in a way, we have to practice mindfulness. But think about it, mindfulness has been around for millennia. If you go to Glenstall Abbey, and you listen to the monks chanting, or if you walk out in the garden and people are out doing their gardening and they say their time just flew, that's mindfulness. That is mindfulness.
Yeah. There's another interesting one here, Eddie, and I'm sure a lot of people in the audience are feeling this. Hi, Eddie. My mother has had cancer and lives alone. I visit her every day and cannot only stay the designated, can only stay the designated 15 minutes. I am anxious that I will give her COVID, even though I don't have it. But I feel loneliness will kill her if I leave her alone.
So I'm just gonna try and find that, just to read that myself. So that lady's visiting, or lives alone. I visit every day, and I cannot stay. Cannot only stay the designated 15 minutes. And I wonder, is there a structure there to visit your mum, but stay wider apart in an outdoor area? Is that a possibility? So that if you're very conscious about this, your circle of control, as in your hand washing, your social distancing, the amount of connections that you have, it is just a balance, there's a balance around, I feel the loneliness will kill her if I leave her alone. So in a way, you're getting distressed, that lady's getting distressed leaving her mum, and there's a yearning. I can feel that yearning as she's leaving her mum. So could it be that you restructure the environment and stay further apart, but stay longer? Why? Can you come back to us and maybe say why, if that's not possible for you? Because you can stay long. That might be a misunderstanding of the rules around 15 minutes. I think you might be either. I might be misunderstanding that, or both of us will get clarity in that. But I just think if you can stay 2 meters apart in an outdoor area, the weather's good enough now, and then if your mum is not in I don't get a sense that she's in hospital. Do you get the sense that she's in a hospital or a care environment? I'm not sure. Maybe come back to us and give us a sense of that. But I think if you stretch 2 meters apart, outdoor area, you can stay longer.
Okay. There's another one here, Eddie. This is from Bernie. Hi, Eddie. I have been dancing with cancer for almost 8 years now. I don't think too much about my cancer on a daily basis, but my anxiety is getting worse as the lockdown release is moving on. I'm 12 weeks working at home and go for a walk every day, but haven't been out to see anyone, as I'm worried the more people I see, the greater chance of coming into contact with the virus. I'm on treatment at the moment. How do I slow down the anxiety? Okay.
So you're on treatment. You're in that vulnerable group. You're on treatment. You're definitely in that vulnerable group. I do like this phrase that you're dancing with. It's a dance partner you don't want, but it's there, and you're getting out for a walk every day, but you haven't seen anyone. So the piece then is maybe identifying a person that you can talk to, but that it's outdoors and over two meters away. Like that's that, because in any treatment of anxiety, we use what's called exposure. We ask people to go out in safe ways to. So in that space there, you're really. It looks like that you're concerned about meeting people and you're concerned about connecting with people, but you're still going outdoors. So the question is, if you arrange to meet somebody but maintain all the social distancing, what would happen is your anxiety would come up, would increase, but if you stay and chat for that period of time, your anxiety will come down. And that's, so you obviously stay, you wear your face covering, you stay at 2 meter distance. That's going to happen because there's a lot more activities going to emerge now, and that's happening. We can see it over the last couple of weeks. People that are in our unique circumstances, as in family members and carers of people with cancer and those with cancer, are very concerned and would have concern about. It's almost like there's a question. It started off with a heroic response to the coronavirus, and we protect everybody. And now there's a level of exhaustion, and now there's a level of questioning. And then there's a question. The question is, the phrase is no one being left behind. But how do you have no one left behind? And then you see all this movement that's going on outside. and there's people have livelihoods are trying to so there's different pockets in our society that have different needs and wants and concerns. I think
another one there, Eddie, from an anonymous attendee as well. Hi, Eddie. I finished my cancer treatment 2 years ago, and since COVID-19, my every waking thought is that my cancer will come back. How do you advise me on how to deal with these feelings? My every waking thought. That's quite strong, isn't it?
Yeah, it is strong. And then there's another person there who says, I've been cocooning for weeks now and feeling worried about potentially re-entering society. It's consuming my thoughts and causing great anxiety as I worry about catching COVID, being so vulnerable while I'm on treatment. Any tips to manage the thoughts? So one of the things we would look at is, so there's two competing thoughts that's there. One is about my cancer coming back. And another one is I can't catch COVID, and because I got cancer, I'm particularly vulnerable. It makes me more vulnerable, which it does. So then the question is, go back, is like you've now, if you think about it, you have been 3 months through the peak of this pandemic, where it's been the RO rate, the infection rate has been particularly high. So when the first pandemic came in, a person on average was infecting 30 other people, 20 to 30 other people. That's now under 5 people. The infection rate's gone very low, which means that you can go in and trace, track, and treat is the sort of piece. So you've done what you have to sort of balance that thought and saying, okay, this is my advice, is I have survived the peak of this transmission and not caught it. So I'm going to engage the similar behavior to ensure I don't get it as best I can, as in the social distancing, the hand washing. It goes back to that, and face covering.
There's one there, Eddie, like just in terms of what you've just said, and it's Eileen who's actually saying no matter what she does, it's there, like she's preparing herself really well with the hand gel, the mask, going out to the shop for some milk, or to post a letter, and she's still she's returning and she's anxious. She doesn't seem to be able to talk. She says here, I don't seem to be able to talk myself out of no matter what I prepare myself mentally. Any tips to relieve this would be very welcome. So it sounds like she's struggling very much with even the going out for a short spell of time.
For some people, they may need additional supports, additional counselling or like cognitive therapy support. How about with that, Angela? I return to anxiety, not be able to talk myself out no matter what. What would be really interesting there for Eileen is if Eileen measured her anxiety from 0 to 100 before she went out. So let's say it's 90 or 100 because I'm leaving now, I'm leaving the house and I'm going outside. And then I come back in. And an hour later, if it's like you would predict that it would drop to a 70 or something. And then you get the sense, but you try and monitor that for a while. And then you try and figure out what is it that's driving the anxiety, the thoughts, the anxious-based thoughts. And say, well, okay, so Eileen, you try and bring a balance to it. You might say, well, I've been out 10 times now. And I know that when I go out, I'm going to be anxious. I know when I get back, I'm going to be anxious. It's going to take me time to settle down. So you start doing a counter talking to your anxious-based thoughts, where so this is where it's not about thinking positive. It's about you do a counter thought and goes, well, I've been out 10 times now. I've gone out and posted a letter. I've gone out and bought milk. I've gone out and I've been out in the peak of this. I've been out, but I've never caught it. So it's the worry that's more distressing than actual the fear of it. It's an anticipatory fear. People with panic attacks get this quite frequently. They might have had a panic attack. I bet participants will be familiar with this, where they might get a panic attack, but they're not. They're actually more worried about the next panic attack. and that anticipatory fear can drive a lot of distress. It's a great question, I have to say.
Yeah.
And this just gives you a real feel for, this is like the real, these are normal reactions. Like, this is a big message I want to put out tonight, that these are normal reactions to this threat, this threat. And because there's a level of vulnerability, it's more amplified for individuals who experience cancer in their life. Any other questions?
This is interesting as well, because we mentioned this kind of in some of the opening remarks there. I finished treatment in February. I was starting to get back to normal levels of social activity, fitness, etc., and planning to get back to work when COVID kicked in. I am almost bothered by the pausing of this than worrying about the disease. COVID feels like an extension of life during treatment. Any words of wisdom? 7:38 there.
I finished treatment in February. I was starting to get back to normal levels of planning to get back to work. I'm most bothered by the pausing of this than worrying about the disease. The pausing of getting back to normal life. COVID feels like an extension of life during treatment. But I tell you what, I think that's the words of wisdom are coming from you, attendee there, that COVID feels an extension of life during treatment, as in things being paused and put on hold, and your inability to make plans and an inability. But I wouldn't let it stop me from making some goals, whether it's around your fitness, because that'll stand to you, or getting back to work. What would that getting back to work look like with your employer, to maybe discussing what is there accommodations that need to be had. I wouldn't accept the pausing in the terms of those areas. I think I'd be proactive in identifying what you need to do around your own fitness. Your fitness doesn't need to have stopped now. If your fitness was via communal classes in a gym, then you might have to rethink your fitness and how you might do that. Yeah.
Eddie, this lady has come back to us. You know, the lady, I think this is the same lady who would have gone to see her mother and spent the 15.
Yeah.
It's there 7:45 p.m. Hi, Eddie. I am staying longer, almost 2 hours with my mother, but I feel anxious because once I am there, she wants me to do sit and chat or have a cup of coffee or help her with the things around the house. She also has other health issues, but only has me.
So, but if that is the same lady, there was a concern about the 15-minute piece and the mum and loneliness. Yeah. So it could be then that it's that discussion about the length, not the over length of time, but about I'm not sure if that's the same person, but if you're staying there and I'm staying longer, could be it, but I feel anxious. What's driving that anxiety? Are you back to that 15 minutes? I should only be with her 15 minutes. I don't think that's the case. If you're sitting in a appropriate area, well apart, then that 15-minute period, I think you need, who would be, if you could ring the HSC helpline, they'll give you reassurance on that 15-minute period. Okay.
Okay.
Yeah.
And there's one here from Sarah. Hi, what type of therapy would you recommend to me to manage my fear of cancer returning? I need to learn to switch my wandering thoughts off. Thanks, Sarah.
Sarah, so it's not like, if you did systems-based or reality-based therapy, you can turn your thoughts off. Actually, when we work a lot with trauma, and I think cancer is a trauma for a lot of people, how we experience people that experience trauma really want to turn those thoughts off. Okay, well, actually, what we do in therapy is we we face those thoughts. We help in a supportive way individuals to face those thoughts, so that those thoughts don't have any power over them anymore, that the power of those thoughts is reduced. And I suppose that's one of the valuable pieces of doing counseling-based work, about the impact, the thoughts. And it's about, so then it's, and acknowledging that it's pretty normal fear to have of a cancer returning. So I would say, first of all, engage in some counseling, and maybe cognitive therapy might be of value. But anyone that says they can turn your thoughts off are probably not doing the treatment that you deserve, because we don't want to turn thoughts off. We want to make them less intrusive, less powerful, ways that you can cope with them better.
So thanks, Eddie. Thanks for all your questions. There's a lot of questions there. I think you probably answered most of them, Eddie.
I hope so, yeah.
Eddie, can
Just an update.
Pardon?
Eileen gave us an update. Increased by the amount of negligence outdoors at shops and pan. I think to withdraw is that before I leave the house, I agree with you about sounding like a panic attack. Sometimes I do feel close to one, but I'll not give it in or out. Many thanks, Eddie, for answering my question. No worries, that's great.
Great. So we're coming to the end of the session, Eddie. Thank you very much. I suppose before we go, I'm not sure if you have a mindfulness technique that we could all maybe, I suppose, embrace or not, as the case may be, but or even just let, I suppose, give somebody your final thoughts on cancer and COVID and your best advice, if you like, all around it.
Yeah, so I just think there is obviously a different level of vulnerability. The narrative, the way we think about it, talk about it, is different, because there is that just that sense of vulnerability. So what I'd say to you is, look, come on over and join us on a Thursday night at 9:30 on my Facebook page, and we've a lovely community going on where we can connect and chat, and we talk, and we